Non-communicable diseases and mental health are inextricably linked. However, there are some unique aspects with mental health that require special attention. This high-level meeting is a significant opportunity to secure progressive commitments to deliver high-quality, rights-based, person-centered mental health services, which are integrated into primary and community-based care. I'm extremely honored to be a member of the Global Mental Health Action Network.
And proud member of the Global Mental Health Action Network, representing 6,000 members from 170 countries.
Member of the Global Mental Health Action Network.
And a member of the Global Mental Health Action Network.
My name is Muskan Lamba, and I'm representing the Global Mental Health Action Network today as a youth representative.
The Global Mental Health Action Network, red que reúne a más de 6,000 activistas de salud mental de más de 170 países.
Highlighted in the Global Mental Health Action Network's policy brief.
I'm speaking on behalf of United for Global Mental Health and as a representative of the Global Mental Health Action Network that brings together 6,000 advocates from 170 countries. As mental health advocates, we recognize that the UN High-Level Meeting on NCDs and mental health presents a unique opportunity for member states to accelerate global progress on mental health.
Es raro que la salud mental esté en el centro de una reunión de alto nivel de la ONU. Es vital que usemos esta oportunidad para acelerar el progreso en salud mental mediante su integración con las enfermedades no transmisibles, para que millones de personas como mi hermano puedan vivir una vida plena y encontrar el apoyo adecuado cuando lo necesiten.
This high-level meeting is an opportunity for member states to commit to invest in mental health and to make interventions accessible to all.
Mental health is not a silo. It intersects with climate, poverty, gender, education. In 2025, it is not radical but necessary to say mental health is the thread running through all sustainable development goals and whichever goals may come next.
I want to drive home the point today that mental health is not an abstract concept or an issue secondary to other health concerns. Mental health is intrinsic to every health issue, every patient interaction, and every non-communicable disease intervention, and determines the quality of the lives in which we all live.
I have observed and witnessed that mental health is often not prioritized even at the policy level in several African countries, and in those nations that do not have policies in place, these commitments frequently remain unfulfilled.
And yet annually there is a monumental $200 billion finance gap for mental health. This is too big of a gap to ignore.
As a young advocate, I know firsthand that authentic progress begins when we invest in people-powered responses, especially those from youth and those with lived experiences. Both NCDs and mental health are profoundly shaped by the circumstances in which we are born, grow up, work, live, and age.
Considerando que la salud mental está profundamente influenciada por las circunstancias en las que nacemos, crecemos, trabajamos, vivimos y envejecemos, la salud mental tiene una conexión bidireccional con el desarrollo sostenible.
We are calling for collective appreciation that one's mental health is shaped by social and commercial determinants.
As a psychologist, clinician, and researcher, I have witnessed firsthand how structural forces shape the mental health and well-being of communities.
But what I've learned is that people are not broken, systems are.
Anxiety and depression are natural, treatable responses to hardships like poverty, systemic injustice, and harmful commercial practices.
We recommend considering mental health and NCDs in the context of social determinants and encourage a population health approach, as an individual's well-being cannot be considered in isolation from their relationships, communities, and societies.
And while statistics help us understand scale, mental health is also about dignity, about every person's right to live, to be heard, and to heal.
This is due to the increasing magnitude of conflict, poverty, migration, youth unemployment, epidemics, weak health systems, food insecurity, and climate crisis.
Having climate-resilient health systems is crucial, especially in small island developing states where I'm from, live, and work.
Address social, environmental, economic, and commercial determinants that are contributing to the burden.
However, there are times that further support needed, yet hardly available in the community and the system.
Community-based care can be helpful in detecting and treating early, which is quite cheaper and cost-effective.
Community-driven holistic care solutions honor individual dignity and lived experiences, empowering communities to create culturally sensitive and effective health models.
We need services that are rights-based, peer-led, culturally grounded, community-based, person-centred, where healing is not done to us, but led by us, drawing on our collective lived experience wisdom.
Erradicando la institucionalización y la sobremedicalización para avanzar hacia la prevención, la intervención temprana y la implementación de servicios de salud mental comunitarios.
It is critical governments shift health systems from the inequitable one-size-fits-all approach towards models of people-centered care that integrate mental health and NCDs in primary care settings, making services accessible where and when people need it most.
Decentralizing care away from the institutions towards the community is critical. We can deliver mental health care that is effective and cost-efficient through lay providers and people with lived experiences.
Additionally, they may incur catastrophic out-of-pocket expenses for treatment.
This is why I urge Member States to politically declare an equitable investment in care away from harmful institutions through a deinstitutional approach, care that doesn't pathologise and medicalise human suffering, grief, trauma, poverty, sexuality and all those intersectionalities.
Strengthen community and primary health care that integrates NCDs and deinstitutionalizes mental health services.
Reform services by transitioning from institutional models to rights-based, community-rooted, and culturally inspired mental health care. Integrate preventative mental health across systems.
Countries should develop a national plan for gradually shifting the locus of care and resources from costly, long-stay institutions towards cost-effective, community-based models of care.
Deinstitutionalizing mental health care and collaborating across sectors leads to better mental health and well-being outcomes.
And I want to ask you all right now, are you in pain? Where does it hurt? Suicide takes place when pain exceeds resources for coping with pain. His suicide shook me to the very core of my being. I didn't understand how I could miss it. What I discovered was that every 40 seconds, suicide is affecting all of our worlds. How we address suicide and the decriminalization of suicide is a true litmus test of our emergency and crisis readiness and an indicator of accessibility to community resources and effectiveness of those services.
One of the remarkable programs that we have been doing since 12 years ago is our youth peer support program, equipping them with the capacity to detect and intervene mental illness and suicide.
Despite a slow decline in suicide rates in general, the number of young people being lost to suicide is actually growing. A young person today is actually more likely to die by suicide than the previous high-level meeting.
In 25 countries worldwide, suicide attempts are merely excluded from health coverage. They are criminalized.
And this needs to be changed immediately. We should be helping persons at their lowest, not punishing them.
We must urgently work to decriminalize suicide.
To update laws and systems to decriminalize and prevent suicide.
And repealing discriminatory legislation such as the criminalization of suicidal behaviors.
Decriminalize suicide attempts and include suicide-related injuries in national health coverage. In some countries, to decriminalize also means to decolonize.
Globally, young people are facing a generational mental health crisis. 50% of mental health conditions begin by age 18, and youth suicide rates are rising.
More than 1 in 7 adolescents are diagnosed with a mental health condition. We need to address poverty, family dysfunction, substance abuse, misuse of social media, all of which are key drivers to poor mental well-being of our children and youth.
Despite these systemic barriers, young people continue to rise as leaders. Our health systems should be malleable to their voices and the voices of people with lived experience.
And most of all, I'm a person with the lived experience of NCDs and mental health crisis.
I ended up institutionalised myself for over a year, over 9 hospitalisations, often unaddressing my needs, my preferences and human rights.
Cuando tenía 8 años, mi hermano Gonzalo fue diagnosticado con esquizofrenia. Él tenía solo 14 años en ese momento. Esta fue y sigue siendo una experiencia sumamente desafiante y transformadora.
Surviving a stroke at the age of 28 deepened my understanding and appreciation of the urgency of this complex global health crisis.
In my case, it has been 3 of my grandparents to cancer, a beloved uncle, and my 20-year-old friend Sam to suicide. It is the grief, the love, and the meaning of these losses that bring me here today to speak about mental health.
A different realities is possible.
Lived experience is expertise. It's a discipline and it's a social movement in our intersecting spaces.
Recognize the rights to meaningful engagement of people with lived experience, particularly youth, and address the barriers to participation, particularly for those people who live with marginalized identities.
Ensure meaningful participation by individuals across all age groups and communities living with and affected by NCDs and mental health conditions.
Put lived experience experts at the heart of policy and planning. This will build trust, relevance, and impact.
Support capacity development of lived experience experts.
I envision a future where we can proudly tell to our children and future generation that we played a significant role in the history of creating tangible, context-specific, human-centered, and equitable mental health initiatives in our countries and around the globe. There can never be health without mental health. Ubuntu.
Más humanos, más empáticos, más inclusivos y libres de estigma. No hay salud sin salud mental y, sobre todo, no hay desarrollo sostenible sin salud mental.
We are not just here to advocate for ourselves. We are here to advocate for you, all of you in this room and all of you not in this room watching us right now.
Our stories, our struggles, including mental health, and our insights must help shape the future of healthy systems everywhere. Together, we can build a healthier future for all.
We don't ask for a seat at your table. We invite you to co-create a new one.
An absence of mental health in all policies that consider the adverse social and economic conditions individuals operate in will be a disservice to society's most vulnerable.
We waited long enough for mental health to matter, and I hope that September's high-level meeting is a turning point where we stop just promising care and start practicing it.
This upcoming high-level meeting on NCDs and mental health presents a historic opportunity. I urge us to seize it by championing integrated, rights-based, and person-centered approaches. I wholeheartedly believe that together we can transform this political declaration into tangible progress. Let us create healthier environments, stronger communities, and a generation that thrives.
We have a unique opportunity in this room today to create norms and new norms specifically that place good mental health and well-being at the center of our lives and our work. I thank you, and let's do it.